Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about patient engagement. Getting patients to communicate with your practice sometimes can be a struggle, and I think with the growing opportunities that technology is offering in healthcare, the better patients are getting at least responding to communication where their providers, their doctor's offices are sending information. I think that by adopting more of the electronic communication means, such as portals, text messages, things that make communication with the offices more simple and kind of at the fingertips of patients, is only going to continue to grow and be better and better. Before old school, right, we would send paper letters, we would do phone calls, and although I feel those are still necessary in certain circumstances with certain patient demographic or age ranges or preferences, I feel that any practice that doesn't adopt even more kind of progressive communication styles is going to get left behind. Not only because people are used to it, but also because people are going to start comparing you to other practices that they attend or providers that they see and the way that they do things, and they're going to wonder why you don't do the same. Obviously, this can depend on where you're located, what kind of medicine you practice, but I really want to stress how important it is to have the patient engagement for your patients with your medical clinical staff, your billing staff, your front office staff. Patient engagement isn't just for one part of the practice. It's actually supposed to be for whatever is needed from the patient. If it's scheduling appointments that are needed for follow-up or annual rechecks, if it's for bills or outstanding balances, it's for lab results or something like that. All of those different scenarios involve different people or different departments in your practice. And if everyone is consistent in the way that they communicate or expect patients to communicate, it won't take long before you adapt new availability of options that patients will get used to it, they'll like it, and they'll end up using it more and more. Again, patient portals have been around quite a while now since electronic medical record systems have kind of really taken on that front for patient engagement. But now we have a lot more use of text messages, not just for reminders or for reminder of bill balances, but people are able to send documents through text message for completion. They're able to send links for patients to pay their balances. It's not just a reminder to call or send a check. And that makes a huge difference. If you think about how people communicate with other entities in the world throughout their life, they're all the same. Utility companies, your anything that has to do with like DMV or the government, like they all have websites, they all have secure portals where you can message, you can have live chats, you can sometimes get text messages, sometimes you can't, but you get the understanding of this, right? Where you want to make it as easy as possible. I'm going to tell you right now, I'm guilty of not checking my paper mailbox, my snail mailbox. I live in the country, it's down by the road, we have to remember to check it, it's locked, but we only check it a few times a week because most of our communication comes electronically. We do most of our stuff electronically. And so the stuff that's in there usually isn't very important. We do have a service that we sign up through the United States Postal Service that shows us a picture of all the pieces of mail that are coming every day. So if we're expecting something or we don't know something's coming, but we see that something important is in there, or it could be important depending on who the sender is, we make sure we check it sooner. Email is one of those things that people are constantly checking. It's on their phone. They're on their phones all the time. Now, whether they respond obviously is a whole nother situation, but hopefully the way that you're engaging your patients, you have a way to be able to track who's opening, who's responding, how they're responding, how fast they're responding, so that you can kind of get an idea of what's working and what's not working so you can make adjustments as needed. Patient engagement is super important for the revenue cycle of your practice, not only for them to pay bills and account balances and stuff like that, but to also make sure you're getting patients to return for their needs, right? Getting those extra patients and visits in the door so it does generate revenue. You also want patient satisfaction, and the easier it is for patients to get a hold of your office for whatever reason, the happier they're going to be, the more likely they are to schedule appointments, the more likely they are to pay their bills, because they're going to be like, oh, it's super easy, it's convenient, I like this, yada, yada. A lot of the patient engagement, you can take surveys. You can ask patients how their last visit was, or you can ask them what they prefer when it comes to certain types of communication. You can run campaigns to find out, or not find out, for them to find out, for you to notify them when maybe you're starting to offer flu shots, or if you're offering a new service, or if you have a new provider that's offering certain services, or maybe it's a dominant male practice and you have a female coming because you've had a lot of patients asking for that, or there's so many situations where having a strong capability for engaging patients, not only to notify them but for them to respond and ask questions, is a game changer. I know it is hard for a lot of the old school practices, old school providers to adopt this because they kind of have a hard time understanding it, or their patient demographic is more of the maybe population that doesn't really like all of the electronic communication. But there should be some flexibility in that as well, where you could keep people to the phone calls, the paper letters, the paper lab results, whatever they prefer, and that you should be able to see who prefers what in your system. With the advances nowadays with the electronic medical record systems, with all of the different third parties out there that will integrate to your EMRs, there's so much out there. So if you haven't explored it, if you see that you're struggling a little bit with patient engagement or patients responding to things, if you're not getting patient bills paid as much and you feel like you have a strong collections in-house patient collections process, I encourage you to explore, find out what your EMR system offers if they do. If they don't, check out other third parties. I know there's so many out there. Since I even was on the clinic side, I hear people kind of mention different companies here and there. I don't know much about them. I just know they exist. So I'm sorry I can't help you with exactly pointing you in the right direction, but I'm sure it's a simple Google search to say patient engagement platforms that interface with electronic medical record systems, and I'm sure it will pull up a bunch so you can get demonstrations, you can ask questions, those types of things. But again, patient engagement, super important to all practices, especially certain specialties, but all specialties, just some more than others. And just customer satisfaction, patient safety is another thing. And also being more efficient in your practice overall with your staff and how they engage and interact with your patients. If you have any questions or comments about this, if you use a third-party vendor yourself for patient engagement, please, I would love to hear from you. I would love for our community that watches my videos to know what other options are out there, what is liked, what's not liked, what they could explore themselves if they were interested. So please, I encourage you just to name what that system third-party vendor is and what you like about it, and we can go from there. I appreciate the support. If you feel like this video was helpful, smash the thumbs up button. Subscribe to my channel if you haven't already. And please share this with your colleagues whom you feel would benefit. Again, be well. We'll see you next time. Bye-bye.